Welcome back to the final seminar in our series. So far we've looked a little bit at each side of the Aspie-NT equation of marriage, and to be fair, I've spent a lot of time trying to explain the Aspie mindset and some of the Aspie wiring, and maybe perhaps that does come across as more NT focused, but I really want NT spouses to have a better understanding of some of the behaviors and some of the experiences that they're having with their Aspie spouse. But as we looked at each side of the equation, you can see from both perspectives that each side has hurts, disappointments, frustrations. Each feels dismissed, either feeling dismissed from the Aspie spouse about the NT, you're not listening to my ideas, you're not connecting with me, but the Aspie spouse also sometimes feels dismissed because now that there's a label, maybe now what I want to contribute you dismiss because of my Asperger's. So both feels rejected at times, and both feels blamed by the other for various issues. And those are the things that we really want to tackle in marriage therapy. So whether NT or Aspie, each side is going to view marriage situations from their perspective. That's what we all do. We're all going to see from our perspective. So we've looked a little bit at the wiring. We've looked at the diagnostic criteria. We've looked at maybe how Aspie's, the criteria, what they might manifest like in young adults, and sensory issues, what each side has to say about some of the issues, and the impact that on a marriage relationship. Well, what is slightly different is if the wife is the Aspie. So throughout the 3 series of the presentations on Asperger's that I've been a part of, I've been saying that there are subtleties in Aspie girls or Aspie women. Now, 3 of the best resources for understanding Aspie females come from Aspie females. The first is Aspergirls by Rudy Simone. Another would be Sisterhood of the Spectrum by Jennifer O'Toole. And I Am Snamu by Laura Nadine. Another one from a clinical perspective would be Asperger's in Girls, which includes Tony Atwood and 6 other experts. And then we also have Temple Grandin wrote a chapter in that book. So those are some very good resources for you to get as books, whether you're a female trying to understand some of the nuances of Asperger's in females, or if you're a clinician and you would like to understand better how those with that mindset and wiring are trying to explain to you. You can get a better understanding from their point of view. There are a lot of books recognizing now what we call pink on the spectrum. Finally, in this decade, we're getting some research and some materials based on females, female wiring, and some of these little nuances that we've been missing as clinicians, parents, and educators. Aspie girls tend to be about 5 to 7 years behind in romantic experiences. We might call them late bloomers, but developmentally, all Aspies are socially up to about 5 years behind their peers. So a 20-year-old Aspie lady might still be emotionally thinking at a 15 or 16-year-old level. As to be careful not to offend, I'm talking about being that 15 or 16-year-old level emotionally or in maturity, not in IQ or intelligence, just in that relational style. So someone in their young 20s might actually be more intellectually mature up in the mid-20s to early 30s, but emotionally and relationally how they're relating is still around 15, 16, 17 years old. And that sometimes causes some issues in forming relationships, in dating, and long-term partnerships. Aspie women may tend to dress more for comfort due to their sensory issues, more than that latest trend or fashion. They may try to camouflage or imitate someone that they deem socially successful. I talked a little bit in my teen spectrum video about Dr. Atwood talking about how girls can effectively camouflage their confusion in social settings, and they may achieve a superficial achievement of social success by imitating others or avoiding social interactions that are unpleasant. So they may adopt this alternate persona, which may give the wrong diagnosis sometimes if a clinician's looking at this. If a person's talking about the Aspie female saying, you know, I just feel like this person around this group of friends, and I feel like this person, now I have to develop this whole different kind of persona, it would be easy to think, well, she must be histrionic, or maybe she's bipolar, or maybe she's developed dissociative personalities. But that's not it at all. what that person is trying to do is trying to socially camouflage or to imitate as a survival mechanism.